I was listening to once Dr. Bruce Lipton talk about tonsils, how important they are for the immune system, for catching things, and that how removing the tonsils is not a good idea if possible. And of course, conventional medicine says tonsillitis, you could just remove them. I was wondering your thoughts on tonsils, even going into the appendicitis and other things. What are your thoughts on when someone has an issue with them? Should they look to remove them? Is that the proper first step, or can we look to preserve that in any way?
Well, I think that there's an evidence-based approach that has kind of evolved over time. If you're from my vintage, you probably remember that there was a time when, you just had your tonsils removed because that's what was done. If you had more than one tonsil infection, they were gone. And it was just considered a preventative measure with very little downside. And while there's no clear evidence that having your tonsils removed can have an impact on your health later in life, uh, that question has never been asked.
Yeah.
And so I think what I do in my practice is on a case by case basis. And when I see people who've had recurrent tonsil problems, of course, I will target that with neural therapy if it's appropriate. But things like oil pulling
Mm,
are an excellent, that's an example of how you can drain the soft tissues of the oropharynx and the nasopharynx from any mucus, and you can engage the muscles that promote the lymph to move.
mm,
Uh, there are manual therapy approaches that may support release of mucus from the tonsils. Think about someone who has had two or three whiplash injuries and think of all of the tension in the head and neck preventing the tonsils from draining. It might be appropriate to consider a short course of acupuncture,
mhm.
6 to 12 sessions to see if that can support the lymphatic drainage of the head and neck as a whole. It's kind of silly to think of the tonsil as a discrete structure that's just sort of sitting there by itself. It's part of this whole network. Uh, and so, from my perspective, neural therapy has been a wonderful approach. And I think it's really important that more people learn to do neural therapy and more people have access to it. But my focus on blockage-based care comes from the notion that the really profound thing is not that neural therapy is treating these lesions, it's that medicine doesn't even know that they exist. And we're all walking around with these lesions that are treatable like germs. Before we knew that there were germs, people were treating pneumonia with, mustard plasters and things like that.
Mhm.
And this really just creates a whole new avenue for reducing the global burden of disease.
Yeah. And it goes beyond just scar tissue, right? When you talk about neural therapy, you look at segmental therapy, subcutaneous kind of injections to stimulate certain organs, the organs of elimination, and everything. Can you go into that a little bit for someone that's never really experienced it? Because most people, you think of an injection, you think of in the muscle, deep in, your vaccine kind of shot or whatever, and that's an injection there. But a lot of this is somewhat painless in a sense because people think needles are very painful, but I've received numerous bouts of different types of neural therapy throughout my body, depending on what was needed. And it's really painless in a sense. But talk about how neural therapy can even support organs where there weren't scar tissue or anything.
Well, this is closely linked to the acupuncture principle that nerves that come from the spine will often have a branch that travels to the organ, and the same nerve will have a branch that travels to a patch of skin over the organ. And so that's called a viscerosomatic or a somatovisceral reflex. So, one good example is detoxification.
Mm,
In my practice, I have done chelation therapy for many years. I see a number of patients who have consulted me about how to detox better. And there are many things you can do to support the kidneys and many things you can do to support the liver. But in my practice, often one thing that helps the process is some targeted injections, just very superficial, uh, nothing dangerous, almost subcutaneous, right? You can create skin blebs so you know
mhm,
you're not hitting anything dangerous. Uh, and a few injections over the zone of the kidney, either on one side or the other or both,
mhm,
can help the kidney function more normally, can take it may be that someone had a kidney infection in childhood, or they had a kidney stone and the kidney remained in a state of sympathetic dominance in fight or flight. The blood vessels are constricted. It's focused on protecting the organ rather than normal physiologic function.
yeah, it's interesting because there's so much attention to detox right now, which is wonderful. We should be. I think you can agree there's a lot of toxins in there that get in our bodies that shouldn't be there and causing havoc in our bodies. And there is this, push for more detox and, your saunas and your IVs, IV pop-ups are everywhere and everything. But, the synergy of doing something like neural therapy along with glutathione or your just kind of different type of detoxes that are there just makes so much more sense, doesn't it? Because it's one thing to give the body an element that helps in detoxification. It's another thing to support the organs that are already doing it, right? We forget we have these wonderful organs of elimination that, if working properly, can usually handle the toxic burden. Now, of course, we're getting overwhelmed with toxins, but why not then naturally and easily support it with neural therapy? Wouldn't you say that's kind of the logical approach we should be going and utilizing more than just a singular path to try and just, boost our detox, pathways, but actually utilizing something like neural therapy to really get the detoxification going?
Absolutely. I agree wholeheartedly with that. And I would say one of the light bulb moments for me was uh, when I recognized that specifically with patients who were coming in with heavy metal burden and were seeking chelation therapy. Uh, this is sort of the elephant in the room. It's kind of an inconvenient truth that there's no correlation between the total toxic burden and the severity of the symptoms. And what seems to me to be more the case, it's not just a question of toxicity, but it's a question of hypersensitivity to toxins. So these
Mm,
patients are more like allergic to the pollutants that their partners or their friends, they probably have the same amount of junk in their bodies, but they're not reacting in the same way.
right.
And so it's not just a neurotherapy approach. I'm sure uh, at your clinic, the concept of desensitizing,
Mm,
using vials or kinesiology to identify what people react to, and then using tapping or frequencies or remedies to turn that off. The idea that you can actually become less sensitive
yes.
uh, by desensitizing people to the things that they're reacting to, but also by treating the scars that make them hypersensitive in the first place. And so that's
Right.
where the interface between vibrational medicine and neural therapy comes in.
And that's the beautiful part because it is still a physical modality, of actually placing something and, using physicality with a needle to inject a substance to trigger something. But it's also absolutely acknowledging we are energetic beings and vibrational beings. We react to those things. Our nervous system is a information highway that if hijacked and you don't have cell to cell communication, you will not have proper and optimal health.